Okay, this is the beginning of chapter 22. Before we get started, we need to look at the fact that this is a unit that covers 3 chapters, which is much bigger than the previous units that you've had. This unit has 3 chapters because they are all linked. We put the respiratory system with the urinary system, and we include the fluid, electrolyte, and pH balance chapter. And that's because both the respiratory system and the urinary system are involved in fluid, electrolyte, and pH balance, more so with fluid and pH. So you've got a really long unit with 3 separate chapters. Okay, so just like any other chapter or system, we're going to start with the functions. And then we'll cover the organs and we'll look at regulating breathing. Okay, so here we have an overview of the respiratory system. And this shows a view of the body looking up into the thoracic cavity without the diaphragm present. You can see the space where the heart would be, the sternum. You have two arms. You can see the lungs. You can see the trachea and all the bronchi that keep branching and branching and branching. Okay. So functions, gas exchange. Gas exchange happens in 3 arenas. So unlike with the cardiovascular system where you had a cycle that had to proceed in a certain fashion, in the respiratory system, it's like a 3-ring circus. All 3 rings are going on at the same time, and they all interact with each other. pH and fluid balance. Breathing helps you acquire acids and bases. Breathing helps you get rid of or conserve fluid. So it's a way to get rid of or conserve those materials. Releasing heat and carbon dioxide. Heat and carbon dioxide are waste products. We lose them in expired air. If you think about dogs, they pant to cool off. And that's because they're getting rid of the heat in large quantities. They don't have merocrine glands to help them cool off. They have skin in their ears and their tails to help dissipate heat. And then they have panting. So that breathing is pushing out hot air. Carbon dioxide is a waste product generated by cellular respiration. So the carbon dioxide levels are often equated to your pH levels. So if you hold on to carbon dioxide, then you're holding on to acids. If you get rid of carbon dioxide, then you're getting rid of acids. Sound production houses our olfactory chemoreceptors. Our sense of olfaction is our sense of smell, It's linked to our sense of gustation, which is our sense of taste. Secretion of ACE, angiotensin converting enzyme, for the angiotensin II mechanism, and this helps us to regulate fluid levels. So angiotensin, which is needed for making angiotensin II, is going to help us regulate fluids. All right, so the organs in this system are divided into two groups. You have the upper respiratory tract and the lower respiratory tract. The upper respiratory tract includes all the components of the nose, the pharynx, and which comes down here, and the larynx. Upper respiratory tract infections, when you have a cold, when you have laryngitis, etc. Lower respiratory tract organs include the trachea, all of the bronchi, and the lungs. So if you have a respiratory tract infection, lower respiratory tract infection. Now, one of the things with lower respiratory tract infections is that once you have them, they tend to show up again. Somehow it creates a weakening or making you less resilient. Excuse me. So if you get bronchitis, you're more likely to get it again. If you get pneumonia, you're at a higher risk for having it again. If you get pleurisy, you're at a higher risk for having it again. Okay. So if we start looking at the organs, you have the internal and external nares. You'll need descriptions and you'll need the functions, because this is where you're going to write the functions so that you'll have them for your lab. Okay, external nares are these openings, the two that you see on your face. They're a passageway for air. The internal nares are an opening at the deepest part of the nose. You use the pharyngeal tonsils as a marker. Which is here. You've had that in lab. And you use the hard palate, the distal or the deepest part of the hard palate. And so that's an opening. There's two of them, one on either side. Now, nares with an E is plural. Nares is singular. So again, both of them are passageways for air. Mucous membranes with olfactory chemoreceptors. All of this pink lining is a mucous membrane. It's continuous throughout the nose, the pharynx and larynx and mouth. The mucous membrane is needed in order to produce a fluid called mucus. Yes, that's how you pronounce or spell the name. Mucous, mucous membrane is an adjective. Mucus is needed for several things, and we'll talk about that as we get deeper into the nose. Olfactory chemoreceptors are sensitive to the presence of chemicals, which are either lipid or water soluble and volatile. So in order to smell something, it has to be lipid or water soluble and volatile. Okay, so covers all the internal surfaces. Okay, then we have the nasal cavity and the nasal vestibule. The nasal vestibule is this entryway to the nasal cavity. The nasal cavity is all of the space in the nose, both sides. The nasal vestibule is the part that you can pinch with your fingers on the front of your face. You have cartilage that keeps its shape. The difference between the mucous membrane in the nasal vestibule and the mucous membrane in the nasal cavity is that in the nasal vestibule, you have hair in addition to the typical mucous membrane. Okay, then you have the hard and soft palates. They make up part of the floor of the nose. The hard palate is the bony portion covered with mucous membrane because it has the pink there. The soft palate is the skeletal muscle covered with mucous membrane. Now, only part of the soft palate makes up part of the nose. The other part helps make up part of the wall of the pharynx. It's a luxury to have the two palates. They separate the oral and nasal cavities. So for the nose, it's the floor. For the mouth or oral cavity, it's the roof. Okay. The nasal septum, which you can't see here, is the divider of the nasal cavity. There's a portion of it that is cartilage. There's a portion of it that is made up of two bones. You have the vomer and you have the perpendicular plate of the ethmoid. So this would be the vomer. This would be the perpendicular plate of the ethmoid bone. And this would be hyaline cartilage. Now, when someone says they've had their nose broken, it's typically the hyaline cartilage that gets broken. The bones were covered in the skeletal system. So the nasal septum is going to help increase the surface area. Okay, so nasal conchae, which is plural, or nasal turbinates. Now, technically, the conchae are the bony protrusions of the ethmoid bone. There are 3 on each side. The turbinates refer to the soft tissue that is attached to the bony portions. So here you can see the superior, the medial, and the inferior turbinates. Underneath them are the conchae. And so I don't care which ones you refer to, which term you use, whichever is makes more sense to you. The turbinates and conchae are going to increase the surface area of the nasal cavity. So more mucous membranes. All right, so those are the components of the nose. Now, the functions for the nose includes warming, moistening, and filtering the air. All that goes together. And this is facilitated by the surface area created by the mucous membranes. So the nasal cavity, the nasal septum, the 2 palates, they're all going to help with warming, moistening, and filtering the air. Why do we need to do this? Okay, air is a gas. It needs to be at a higher temperature, higher energy state. So the outside air could be less than the 98 degrees Fahrenheit inside our body. So we have to warm it up to maintain that gaseous state because we don't want it to liquefy. Moisten. Incoming air is dry. We don't want to dehydrate the body. Filtering. We want to trap particles so that they don't get deep into the respiratory tract. So the nose and several components of the respiratory system are involved in warming, moistening, and filtering the air. So mucous membranes, conchae, nasal septum, nasal cavity, palates, all involved in that. Acts as a resonating chamber for sound. Okay, so what do we mean by that? We need to think of, the respiratory system, at least the upper respiratory tract, as a megaphone. You have vocal cords that produce sound. The pharynx is the next organ, and the nose is like the big end of the megaphone. So it's going to amplify, alter, modify the sound that's produced by the vocal cords. So it's like the big end of the megaphone. It's going to make it louder. It's going to make it altered. And you can experience that if you plug your nose, and it's going to change your voice. Because if you don't put the sound waves through your nose and your pharynx, then it's going to alter your voice. So acts as a resonating chamber. The sound waves are going to bounce around and get amplified. Receive secretions from the bony sinuses and the eyes. Okay, in this picture, you can see the frontal sinuses and you can see the sphenoid sinuses. You also have maxillary sinuses and you have ethmoid sinuses. They drain into the nose. So in between these folds, in between the turbinates and conchae, you have openings where they drain into the nose. And that's why a sinus infection is an upper respiratory tract infection, because that's where the drainage occurs. Okay. Secretions from your eyes, the lacrimal glands, both of them empty into the nasal cavity. So, tear production. Most of the time, we don't notice tear production because it drains into the back of your throat. When you cry, most of those are coming out into the face because it can't drain quickly enough into the nose. It's also why you have to blow your nose when you cry, because part of those tears are going down into your nasal cavity. And so that increases the moisture there. Houses your olfactory receptors for your sense of smell. Again, in order to smell something, it has to be volatile, lipid, or water soluble. And your sense of smell is linked to your sense of taste. If you can't smell something, then you're not going to taste it as well. We lose our appetite when we have a cold because we have so much drainage, so much inflammation that we can't smell things. So things taste different. Also, we've got so much mucus going down into our stomach that we lose our appetite. And this is why a lot of when you go to amusement parks or to county fairs, they have fans on all of the food vendors, and that's to stimulate your sense of taste by increasing the smell. So those are your functions of the nose. Again, the components of the nose are included in your lab. And so you will need to use your lecture notes, because why would you go digging through your chapter if you already have your lecture notes on the respiratory system? You'll do the same for the urinary, digestive, and reproductive systems. Okay, your second organ in the upper respiratory tract is the pharynx. The pharynx is a muscular tube. It's got various cartilages. You have a mucous membrane continuous with the one in the nose and continuous with the ones in the larynx and in the mouth. Divided into three regions. You can see them in the three different colors, named for the other organ that they're attached to. So you have nasopharynx because it's attached to the nose, oropharynx because it's attached to the mouth or oral cavity, and laryngopharynx because it's attached to the larynx. So notice the pink. When you open your mouth and look into the back, that's not part of your mouth. That's part of your pharynx. This houses the pharyngeal tonsils and the palatine tonsils, which we've had in the lymphatic system. Collectively, this muscular tube is going to warm, moisten, and filter the air, just like the nose does. It acts as a resonating chamber. So again, if we look at a megaphone, the nose is the big end The pharynx is the smaller end. The vocal cords are what produce the sound. Receiving secretions and balance pressure from the ear. So the ear each ear has a tube called the eustachian tube, and it empties into the pharynx so that you can get secretions. So it's drainage, and then balancing pressure. When someone says their ears have popped, it's a vacuum that has been opened in that tube, that opening. So pressure building up, if that gets blocked by a vacuum, and then secretions, drainage of the ear. Kids that get a lot of ear infections, their eustachian tube is broken, or not broken, it's altered in its shape from that of adults. So it doesn't drain like it should. And so sometimes kids have to have tubes put in their ear that move the secretions out into the outside of the body. So, pharynx. The larynx is a muscular tube with a mucous membrane, and it has several cartilages, but these cartilages have specific names and functions. One of the cartilages, which is the epiglottis, is actually made out of elastic cartilage, unlike the thyroid and cricoid cartilages, which are made out of hyaline cartilage. So, epiglottis, you can see a little bit of it in that first picture. In this middle picture, you can see all of it, but no mucous membrane covering it. And in the mid-sagittal view, you can see the epiglottis with the mucous membrane. So glottis is the opening in the larynx. Epiglottis is outside that. So the epiglottis is going to fold down during deglutition and flip back when you're breathing. The thyroid cartilage is a cuff rather than a circle, so it doesn't completely envelop. You can see the anterior view. You can see the posterior view where there's an edge. They didn't just cut that off. It doesn't completely wrap around. The cricoid cartilage is a complete circle. It wraps around all the way. Now, those are the ones that are part of your lab list. Okay. In addition to those, you have what they call the minor cartilages. And so that's this line pointing to this cartilage and this one up here. That's the arytenoid and corniculate cartilages. Okay, so specific functions. The epiglottis is going to prevent aspiration, so it keeps solid materials out of the lower respiratory tract. Thyroid and cricoid cartilages. Okay, in the mid-sagittal view, The thyroid cartilage is here. The cricoid cartilage is here and here, and so it makes a complete circle all the way around. Okay, they maintain a patent airway, so they keep the larynx from collapsing. Now, it doesn't mean that it isn't going to bend a little when deglutition occurs, moving a bolus from the mouth into the esophagus, which is down here. So they keep a patent airway. Vocal cords produce sound. Okay, this opening is what we call the glottis. On either side of an open glottis, you have vocal cords and you have vestibular folds. So the vocal cords are the rigid cartilage, and the vestibular folds are the membrane that extend between that cartilage and the outer edge of the glottis. You have those minor cartilages, here and here, anchored to muscles. You can see a little bit of them here and here. They manipulate the vocal cords. So if the vocal cords are held really, really taut, then you get a high-pitched sound. If they're relaxed, you get a low-pitched sound. So 2 impacts of testosterone on the larynx. One is to relax the vocal cords, so it lowers the voice, and you get a buildup or an increase in the size of the thyroid cartilage, which we refer to as the Adam's apple. So again, these are going to be part of your lab list, and you'll need the functions. So you've got them already here in your notes. Lower respiratory tract. Now, difference of opinion between the author of the book and myself. He puts the bronchi with the lungs because of their placement, and I put the bronchi with the trachea because they're made out of the same tissues. Okay, so the trachea and the bronchi are tubes. They have smooth muscle tissue. You can see some of that here. There's also smooth muscle tissue. There we go. In here. The C-shaped rings of hyaline cartilage, mucus glands, these larger circles of simple cuboidal tissue, and it's lined with ciliated columnar, pseudostratified columnar epithelium. And so that would be this row here. Okay, so why is it organized this way? Okay, the smooth muscle tissue contracts and relaxes. You have bronchoconstriction, bronchodilation. It doesn't completely narrow it, but it narrows the opening in bronchoconstriction, and in bronchodilation, it's going to open it up. C-shaped rings of hyaline cartilage. Okay, the C shape, this would be the anterior side, and this would be the posterior side. So the open end of the C is on the posterior side, and that's because the esophagus sits here. So when we are carrying out peristalsis of a bolus, this will compress up against the trachea, and the C open shape allows it to the esophagus to expand. That way, you can move material down the esophagus and not completely crush the trachea. Mucus glands, in addition to the mucous membrane, you need more mucus. The ciliated columnar epithelium, pseudostratified columnar epithelium, is going to have cilia that moves the mucus up towards the larynx. And that's why you see this big blue arrow. So the cilia is set up to move the mucus, which is this material here, up to the larynx so that you can move it into the esophagus. The damage to the cilia can reduce that. You have a reflex associated with an irritated lower respiratory tract, and that would be coughing. You have a similar reflex in the upper respiratory tract when it gets irritated, and that would be sneezing. So, forcefully moving air to help move more material. So with the bronchi, that's plural, bronchus, US, at the end is singular. There are a series of branches. They keep getting smaller. When you open up the thoracic cavity, you don't get to see any of them except the primary bronchi, the first branches, if we move the heart out of the way. Okay, so you have two names, and that's because the models and the textbook don't always agree. But main is the same thing as primary bronchi. There's one for each lung. The lobar, those are going to branch into the lobar or secondary bronchi, which lead into each lobe of the lung. The segmental or tertiary bronchi are going to lead into each lobule. Now, there's lots of different tertiary branches, and that's the different colors that we see here. So each lobe has a different color. So that would be the secondary bronchus, and these would be a tertiary, a set of tertiary, and so they come in different sizes. The smallest ones are the bronchioles, and you don't see that in this colored picture. You don't see them in this first picture, but you can see them in this microscopic picture. And yes, they come in different sizes. You have bronchiole, terminal bronchiole, respiratory bronchiole. As far as we're concerned, they're all just bronchioles. The only difference between bronchioles and bronchi is the fact that the bronchioles don't have cartilage rings. So yes, they can collapse. They can swell shut. Collapsing, narrowing is part of asthma. So the wheezing is from the narrowing, and the airflow is impaired. All right. So the lungs are encase the bronchi. Like I said, when you open up the thoracic cavity, if you move the heart out of the way, you can see the primaries. The rest of them are surrounded, embedded in the lung tissue. Okay, so functions for the trachea and the bronchi. Warm, moisten, and filter the air. That shouldn't be a surprise. They also move the mucus up to the larynx so it can go into the esophagus and wind up in the stomach where the hydrochloric acid is. Okay. Each lung is divided into lobes. You have 3 lobes on the right. There's an inferior, medial, that should be medial, not middle, and superior. On the left side, it only branches into or divides into a superior and a medial. So that's how many secondary bronchi are in that size, in each side. Each lobe is subdivided into lobules. And so that's what we see down here. You have lobules. Each lobule is a mass of alveoli. The alveoli are encased in a dense network of pulmonary capillaries. And that's what we see down here in this picture. All those teeny tiny little vessels are pulmonary capillaries, and they're going to be touching the alveoli. The pleura is like the pericardium. The pleura is a membranous sac that encases each lung. So each lung has its own pleura. It has the same 3 components. There's a parietal pleura, which is the outer cover. There's a visceral pleura, which is the superficial surface of the lung. And if we go back to this picture, the pleura is going to cover, out here. Okay. The visceral pleura. And in between the two, you have the pleural cavities, which is that serous fluid filled space. You can see it's thinner over here. So you've got a little bit of it there, but you have a parietal pleura and a visceral pleura. The reason that this side is so much bigger is because when they died, they were laying on this side. And so it all fell over that way. Functions. It's the same 3 functions that we had for the pericardium. So the pleura is going to anchor the lungs in the thoracic cavity. It's going to act as a physical barrier. And it's going to secrete a serous fluid to reduce friction. So every time you breathe in, you breathe out, you got rubbing the lung tissue against everything else around it. Physical barrier, it keeps certain things in, certain things out. The pleura is also going to help with maintaining pressure. With the lungs, you have to have a certain pressure around it and inside. So, surrounding the lungs, you have the pleura. Surrounding the heart, you have the pericardium. Same 3 functions, same 3 components. Pleurisy is when the pleura becomes infected. And so, again, like any other lower respiratory tract infection, once you get it, you're at a higher risk for getting it again. Reduced fluid production or overproduction. Overproduction is going to mean you can't inflate your lungs. underproduction or not enough is going to allow the rubbing and damage to the tissues. That will be the end of part A for chapter 22.